Hello, my name is Summer Flynn. I'm a psychiatric mental health nurse practitioner student at Eastern Kentucky University. I will be discussing my evidence-based project poster, which is Dialectical Behavioral Therapy as an Intervention for Adolescents with Self-Harming Behaviors. Background and significance. Suicide is a leading cause of death in the United States among adolescents. Self-harming behaviors such as cutting or poisoning increase the risk of suicide in adolescents. Adolescents who cut themselves are twice as likely to die from suicide as compared to those who self-poisoned. The Office of Disease Prevention and Health Promotion created a health objective to reduce suicide attempts in adolescents in the United States for Healthy People 2020. Psychiatric mental health nurse practitioners must use strategies supported by evidence-based practice to reduce the incidence of suicide. Identifying adolescent patients at risk of self-harm and non-suicidal self-injury and providing evidence-based practice interventions can reduce the incidence of self-harming behaviors and ultimately reduce suicide. Dialectical behavioral therapy, DBT, is an evidence-based practice intervention for adolescents at increased risk for suicide. Quantitative and qualitative studies have revealed decreased self-harm in the period immediately following self-injury and even 1 year following DBT treatment in patients who received DBT therapy. This evidence-based project poster will provide evidence supporting DBT as an important intervention as well as an intervention implementation plan. Proposed intervention and supporting evidence. The proposed intervention is to implement DBT in an outpatient behavioral health practice. PICO question: in adolescents with self-harming behaviors, how does dialectical behavioral therapy, DBT, compared to treatment as usual affect self-harming behavior within 1 year? Supporting evidence. A level 1 meta-analysis was conducted to determine the effectiveness of DBT as an intervention for adolescents with recent or repeated self-harming behaviors. A large positive effect was revealed, suggesting that completing DBT treatment resulted in adolescents engaging in less self-harming behaviors. A level 2 randomized controlled trial was conducted to determine the effectiveness of DBT adjusted for adolescents as an intervention for adolescents with self-harming behaviors. According to the study, there was a 97% participation rate, and it was reported that there were no suicides during the follow-up. A level 6 qualitative study was conducted to evaluate the treatment acceptability and helpfulness of DBT for adolescents with self-harming behaviors. Middle path DBT has shown improvement in family functioning as well as a reduction in self-harm and dysfunctional behaviors. A high rating of helpfulness suggests that participants view middle path DBT as an effective treatment. Theoretical framework. Gene Watson's theory of human caring is a mid-range theory which has been applied to mental health nursing and a study of patients experiencing symptoms such as anxiety and distress, which can lead to suicide. Watson's theory of human caring, using the 10 Caritas processes, helped to decrease anxiety and increase coping skills in the patients of the study. Implementation plan is the project will take place in an outpatient psychiatric office to stakeholders. Target population is adolescents identified with self-harming behaviors who are not actively suicidal. The patient and family will be informed about risks versus benefits and that participation is voluntary. Also, that institutional review board approval has been obtained. Informed consent will also be obtained, and the patient will be screened using the ASQ and the PHQ-9 screening tool to verify that he or she is not actively suicidal. The patient will be referred to a therapist that specializes in DBT and will begin therapy. Monthly team meetings will be held to give updates on the project. Patient monthly follow-up appointments and progress will be monitored through correspondence with the therapist. The patient will be rescreened using the ASQ and the PHQ-9 screening tools at the 3-month follow-up and the 6-month follow-up. Rescreening will also take place at the 1 year follow-up, and findings will be presented to the stakeholders. Outcome measures. Patients will report 5 coping strategies to use when feeling overwhelmed or stressed within 1 month. Patients will be evaluated using the ASQ tool for suicidality and will not be actively suicidal within 1 month. Patients will be evaluated using the PHQ-9 tool to evaluate the severity of depression and show a decrease in depression symptoms within 6 months. And patients will report a decrease in self-harming behaviors within 1 year of DBT treatment. Conclusion. Suicide has been identified as a leading cause of death among adolescents. Self-harming behaviors and non-suicidal self-injury are 2 risk factors related to potential suicidality. DBT has proven to be effective in reducing self-harming behaviors both in the immediate short-term period following self-harm and at the 1-year follow-up. If this evidence-based project proves to be effective in reducing self-harming behaviors, DBT should become a clinical practice guideline in self-harming adolescents at increased risk for suicide. Thank you.